This is the condition in which expectant mothers at Naguru Hospital face before delivering their babies. According to an eyewitness, a woman bled to death yesterday while giving birth at this hospital. The unfortunate incident is attributed to the negligence on the part of the doctors.
She went into a coma. She passed on. But the possibilities that she was attended to late are very high.
But the hospital director, Dr. Edward Nadumba, denies the allegation.
She developed a complication after delivering, and of course she bled, and that bleeding was from a silent bleeder, which could not be easily identified.
Reports also indicate that another woman delivered a baby on the hospital's floor due to the shortage of beds.
Then she tried to kneel down because the contraction had intensified and the baby was now coming out. So when the process of kneeling down, the baby landed on the tiles.
Dr. Nadumba says the hospital, which was initially meant to cater for 100 patients, now has over 300 of them.
We are overwhelmed by the number of patients, okay? The hospital is only 100 beds by construction, and unfortunately, we are getting more than that number on a daily basis.
The situation has compelled many of the pregnant women to sleep on the floor or share beds. This is the maternity ward. At least 25 deliveries are carried out every night in this facility that has about 15 beds. The hospital director says there are only 10 medical officers and 3 senior consultants to attend to the huge number of patients. This hospital was constructed by Chinese experts 2 years ago to decongest the National Referral Hospital in Mulago. Back then, many people had high hopes that it would help improve the poor healthcare services in the country. But the situation is clearly not any better.
We cannot carry that burden alone. They need to construct other hospitals, okay, slightly bigger than this one around Kampala.
One of the recommendations by the Ministry of Health is that all health facilities provide pregnant women with mosquito nets. But the patients here are all on their own. Some of the patients also told us that the nurses ask them to bring basic requirements like gloves, which are supposed to be provided for free. The initial plan of this hospital was to decongest Mulago. However, with just 3 years of operation, the officers here are already complaining that they're being overwhelmed. The big question remains, how fast will government act to heal this state-of-the-art facility? Sheila Nduchire, NTV Weekend Edition.